Hey, welcome back. I was about to do a video on a twin nursery. However, this happened. So instead, I will do the video on life in the NICU. Just going over how I felt and what you can expect from the NICU. So I actually delivered the boys at 33 weeks in 2 days. And because that was, pretty early, they rushed them to the NICU right away. Nothing was just wrong. They just was born pretty early. So with that comes just growing that they have to do. So they spent a couple of hours there the first day, and I was recovering in my room. I was able to see them the first day, and it's really scary going to the NICU, honestly, because you go there and your babies are hooked up to wires and you don't know what you can do, what you can't do, if you can touch them or not. And so if you happen to be in that situation, I would encourage you to go ahead and talk to your doctors, talk to the nurses as much as you can, really get to know the staff over the time you're there, because that's going to be a really valuable asset depending on how long you're there. So my oldest, Gabriel, he ended up being there for about 3 weeks. And, this is a really emotional time as well. You hear about people in the NICU, little babies in the NICU, but until you're really there, it is very difficult to imagine, because you had a baby, you were pregnant, and then you go home without your baby or babies in my case. And so that's kind of a traumatizing experience. But you really have to just be strong. And I went up there every day to see my boys. And eventually, Gabriel was able to go home at 3 weeks being there. So that was essentially him being 36 weeks gestational age. And then Levi had to stay a couple more weeks. He came out a little bit smaller. He was 3'11" when he was born. Gabe was 5'4", so Levi had a little bit more catching up to do, and that almost made it hard. We were happy to have Gabe home, of course, but it did make it really challenging, as I had to take care of Gabe throughout the day and night, and then drop him off, or leave him for a bit to be with Levi during the day as well. So that became a challenge. If you have twins in the NICU, they will send one home. They will send them home, whoever's ready to go home first. So then Levi was up there. He had a couple of challenges, but he eventually outgrew all of those. He came home in another 3 weeks and I would just say my time with the NICU overall was pretty positive, I would say. There are some hang-ups. Obviously, it's like I said, it's a really emotional time, so anything could bother you. You have small babies, and they're needing medical care, and you're having to go to the hospital every day. And well, you don't have to every day, but NICU, at least where I am, is open 24 hours a day. And I mean, the staff, usually most NICUs, and in my case as well, the NICU staff, they're really great, and they're supportive. And I mean, there was one night I think I went in there crying, and because you have so much hormones still from the pregnancy, and if you had, depending on what medication you were taking, you could be still just not completely there when you are in the NICU. And there are a lot of emotions that go through your mind. And also, this being COVID, during COVID season, people aren't allowed to go up there with you. So that is really hard. In the past, you were able to have your family there and people can go see the baby. But in my case, they weren't able to see the baby for weeks until they came home. So we did a lot of FaceTime, and we got through doing that. But other things in the NICU, I found a lot of really good nurse assets. They really helped me through it. A couple of them, of course, you're going to click with different people, but a couple of them, getting to know your nurses, they really helped me through being in the NICU, helping me do kangaroo care and helping me like when I first started breastfeeding. And I got to know all the staff there. Like, me and my boys knew everyone. Nurses, the nurse practitioners, the physicians, people who were doing the hearing test, the pharmacy, the physical therapy people. I mean, we got to know everyone pretty well, being there as long as we were. But I would say, if you do find yourself in that situation, make sure that you take advantage of all the things that are there for you. So doing kangaroo care, that's basically when you put your baby on your chest and you can like lay there with them. I did that pretty much every day. Sometimes you have to ask, like the nurses, depending on what nurse you have, they may not automatically just say, hey, here's your baby, let's do kangaroo care. Sometimes you'll have to ask for your, like, hey, can I get a chair? Can I, so I would say be an advocate for yourself and for your babies to make sure you get a lot of skin time in and a lot of holding and touching in, if that's possible for you. Also, they had a program where if you bring your breast milk up there, you could get a free meal every day at the hospital. And so I was like, that's great. So I did provide my breast milk for the babies, for the twins, the whole time. And they were able to initially tube feed them that, and then go to bottle feeding them the breast milk. And I was able to get my free meal. So that was just made it a little bit easier time being there. I didn't have to go out to get food. What else? In the NICU, I brought them their clothes from home, which may not be a big deal or may not seem like a big deal. And you're thinking, well, now I have to wash more clothes. But it does make you just feel better. I don't know how to explain it, but bringing up clothes and kind of dressing your baby and, helping feed your baby and change their diapers helps you really get into that whole the spirit of momness, since they're not at home with you. So I would say take advantage of any opportunity to do that as well. But yes, like I said, overall, it was a mostly positive experience, and just glad to have them healthy and home. They do a really good job of taking care of the babies, and they keep them on a really tight schedule. So my little one, who was there longer, he's a little bit more disciplined when it comes to like eating and sleeping. Then my older one is being with me, but that's okay. And so if you have any questions about the NICU, feel free to drop it in the comments. I will respond. And again, subscribe to my channel. And if you have any other topics that you would like to know about twin life or mom life, please drop it in the comments. Thanks.